Can eyebrow transplantation be done? What is microblading? These questions are frequently asked, and to answer these I am here, Dr. Venkataram Mysore, hair transplant surgeon, dermatologist, Venkat Center for Skin, ENT and Plastic Surgery, Vijayanagar, Banashankari, Cunningham Road, Bangalore. Can eyebrow transplantation be done? Yes, it can be done. When to do it? When somebody doesn't have an eyebrow, either because he is born without eyebrow. It happens many cases. The eyebrow hairs just don't grow. Or eyebrows are very thin and small, particularly in this lateral third, where hairs are normally small, it becomes even smaller, or the width is less, or as a result of disease, eyebrow has disappeared, like alopecia areata, hypothyroidism, thyroid problem, leprosy in the olden days, now it is very less. So in such diseases, it can be done. How does it differ? Now there are 3-4 differences when compared to the transplantation on the scalp. One, the eyebrow hairs do not grow long and thick. They grow only grow for 1.5 to 2 months, 1 centimeter, 1.5 centimeter. They don't grow thick, and they are only there as single hairs. You don't find them as 2 hair, 3 hair, 4 hair units. Most importantly, the direction of the hair changes as per location. Now, you can see in this diagram, what we have shown here, this part, medial part, central part, the hairs grow vertically. As we grow laterally, it starts angling this way. And as we come towards this lateral third, it vertically runs parallel to the skin at an acute angle. This is a very important feature of the eyebrow. And you can see that in this photograph also. Now, how is this done? It is done under local anesthesia. We take the hairs from the scalp only. We don't take it from the beard or the body. Beard hair is too thick. It looks ugly. Body hair curls. So we take thin hairs from here. We don't take thick hairs, single hairs only, and plant them after making holes. Whole procedure takes about 1 hour. You need about 200 to 300 hairs on one side, another 200 to 300 hairs on the other side. Depends upon the length. And it is put according to the direction that I just now mentioned. It takes about 4 or 5 months to grow, and the results are quite good, as you can see in this photograph. Patients are extremely happy, because eyebrow, like nose, is a very important part of face. Even small difference makes a huge impact. So as you can see here, it has made a major impact for this patient. Now, what is microblading? Microblading is different. It is something like tattooing. Here you make holes which are elongated, like with a brush-like stroke with a blade, and then fill color in it, something like tattooing. And because it is done with a blade, it looks or mimics a hair. So it is basically to create an impression of hair. You don't put hair. Please understand. Microblading, there is no hair which is put. You just put a elongated dot to create a black dot to mimic the hair and make the hair looks more impactful. It is a simple local anesthetic procedure. It is quite effective, particularly in very fair patients. Because in very fair, particularly Western patients, it mimics the hair well. In South Indian brown patients, that match is sometimes a little difficult. So one has to be a little careful. And if it is not done properly, it can look bluish in our skin, South Indian skin. So So this is something you have to be very careful about. Sometimes people ask, are there any drugs for eyebrow growth? Well, there is a drug called prostaglandin which we use for eyelashes. The same can be used here. It's not greatly effective, but can be tried in those who are not willing to go for these other procedures. Are there any complications of transplantation? Complications are few if it is done well. They are very rare. But the issue is eyebrow transplantation needs to be done with care and by an expert. Otherwise, the direction can go wrong and that will look awful. I just now told you that eyebrow is like your nose. Even small difference can be noticed. So you have to be very cautious. Don't get it done by anybody who advertises. Make sure that he has expertise in it. Then only you should do it. Now, to summarize, eyebrow transplantation is possible when eyebrow is not there or to widen it. It can also be done for diseases like alopecia areata, but only when the disease is stable, not in early cases. It can also be done for grey hair removal in vitiligo, leucoderma. Sometimes it affects the eyebrow and then the hair becomes white, it looks ugly. So we can remove the white hair by FUE and put a hair in its place. It is possible. It's a comfortable outpatient procedure. You go home the same day. Results are quite good when done by expert. Microblading, on the other hand, is a mimicking procedure. There is no hair which is put. It is a form of tattooing. So I hope you have liked this video. It has been useful. Please communicate to us. Any further information, visit our website venkatcenter.com. Please share this video, and if you need any other topic to be covered, please communicate to us. Thank you very much. Good day.